The classic symptom of active phase was pain with erections, but this is still not totally accurate. 1/3 of guys will have onset of curve with no pain, and even after having stable symptoms for many months. Hi guys, I'm Kristen Gumpf, a PA specializing in men's health. If you're enjoying the content, then like, comment, and subscribe to our channel. We're continuing our Straight Talk series on Peyronie's disease, and we'll be discussing active phase versus stable phase. So, some type of injury has taken place, but for the majority of guys, it wasn't a significant injury that they remember, and more likely a micro injury that leads to a plaque or scar tissue formation. This scar tissue goes through an active phase, which can last anywhere from 6 to 18 months, so a pretty wide range, and honestly difficult to say 100% what phase you're in. The general consensus is that if your symptoms have been stable for 3 months, then you're likely out of the active phase. In this time, the plaque and symptoms can continue to change. Data shows that from onset of curve, 48% of guys will see worsening of curve, 40% will see stability, and 12% will see improvement in curve. The classic symptom of active phase was pain with erections, but this is still not totally accurate. 1/3 of guys will have onset of curve with no pain, and even after having stable symptoms for many months, some people will continue to report discomfort with erections. This could be a tightness or pulling sensation, or just that it feels different than it used to. In the end, the concept of active phase is important to discuss to know what is possible from a symptom standpoint. Treatment at this time usually focuses on supportive therapy, traction, daily Cialis, and other oral medication options like pentoxifylline and L-citrulline. Classically, more definitive treatment like Xiaflex has only been recommended in the stable phase, but data has shown comparable outcomes with treatment in the active phase too. Stable phase then is just that, when symptoms are stable. At this point, curve or other symptoms are unlikely to change on their own, and the question then is how bothersome are the symptoms? Proceeding with treatment is always driven by whether or not the patient is bothered enough to treat. Some guys want evaluation to make sure they don't have something like penile cancer, which is understandable, but they aren't interested in treatment for the curve. Other guys are definitely interested in treatment. So then stable phase treatment could consist of traction therapy, Xiaflex injections, or surgical intervention like plication, plaque excision and graft, or a penile implant. These treatment options will all be explored in depth in a future video. So again, like, subscribe, and leave your comments down below. See you next time.